Good afternoon, this is Dr. Do again. This video is still on alphabetical list of problems and we're still on the letter B. Today I'm going to talk about the bone and the bone disease. Before I talk about the bone and the bone disease, I just like to briefly talk about what kind of disease you need to go to the emergency room related to the bone. Basically, of course, injury, acute injury, tissue swelling, feel painful, may or may not have the open fracture or fracture, but still if the acute injury cannot move, impaired motion, very painful swelling, and go to the emergency room. This is a common sense. The other possibility is not quite common. It's called osteomyelitis, which means the bone marrow infection. This usually does not occur in healthy people. For those who have immunodeficiency, comorbidities, or organ transplant, undergoing the immune suppression medication, or immune deficiency disease, or diabetes, such as those are the comorbidities. So if you have these kind of conditions, and you suddenly feel fever, very high fever, spike, you feel shivering, and your bone pain. If that's the case, I'm sure your doctor probably already told you. So if that's the case, you need to go to the emergency. The sooner the better. Other than that, usually the bone marrow infection like the osteomyelitis is not quite common to the normal people. Like I said, unless you have the comorbidities or another chronic disease like the kidney disease, liver disease, immune deficiency disease, organ transplant, or heart disease, etc., etc. So if you have these kind of conditions, then if you feel high fever and also feel bone pain, if that's the case, go to the emergency. The other emergency situation is not directly to the bone problem, but it happened to the bone, which is the sickle cell crisis occurring in some people. Probably they already know it. The physician already gave them the warning sign. If this happens, you need to go to the emergency. Those people will feel bone pain, sternum really pain, and also feel fever, may or may not have fever, feel tired, and cruciating pain on the sternum. If that's the case, I'm sure your doctor already told you, go to the emergency room, rehydrate, and pain management, you feel better. So these are only the three scenarios I can think that are related to the bone disease that you need to visit emergency. Any bone condition that you can manage at home, pretty much, unless it's preventive, prevent from the osteoporosis. So you take calcium at home. Even though the osteoporosis, for example, you still need to be managed under the guidance of the physician. So having said that, bone disease either emergency or managed by the doctors, or preventively eating calcium and vitamin D to prevent osteoporosis. Okay, now I'd just like to give introduction of the bone. What is the bone? Actually, in order to understand that, bone is a kind of connective tissue. Can you believe it? So talk about tissues. We have 4 types of tissues in the body: muscle, nerve, epithelial like skin and mucus, and the connective tissue is a whole group of the tissue. Bone is one of them. This connective tissue include bone, cartilage, blood even, and the fibrotic, adipose, etc., etc. Bone is one kind of the connective tissue. So in our body we have, it is also an organ, which means connective tissue and also other tissues together make the organ of a bone, individual bone. For example, the humeral, the femur, these are the organs, but they're formed by the bone tissue, which is a connective tissue. Anyway, these are the medical term. Probably you're not interested. We have 206 bones in our body, if I'm correct, and the different shape, and the flat, the long bone, and the irregular shape. The flat bones, the function of the bones, of course, you know it, mechanical support, movement, And the other important function of the bone is the making bone marrow and making blood. These are especially for the flat bones like the sternum and also the skull and also the pelvic bone. These are the major bones that contain bone marrows, rich of bone marrows that produce blood for the adult. For children, they have different story, like the other organs, like the spleen and the liver and the bone, they both can produce. But for the adult, flat bone is where the blood come from. The diseases related to the bone, you need to see the physician. We talk about the emergency, we talk about the preventive manage at home, and the disease is the most important one. You already know the calcium deficiency caused either in children cricket, which is the bone is soft, and because lack of calcium, and in elderly, particularly menopause, postmenopausal women, osteoporosis. So these are the problem. You need to bring either your child to the physician. What is the sign for children have calcium deficiency and cricket? It's the skull change the shape, and the chest change the shape. It's not regular barrel shaped. And for the older people, osteoporosis, it's quite often, especially in low body weight, Asian descendant. So if you have that, I'm sure your ear physical physician will do once in a while, every 5 to 10 years, to do this bone density scan, will tell you whether you have osteoporosis or whether you're at risk or whether you're not. In addition to that, there's another disease. It's kind of subtle, which is metastatic bone cancer. It's usually from lung cancer or from internal organ cancer, metastasis to the bone, to the spine. The symptoms is called the pathological fracture. The symptoms is very subtle. You feel back pain. It could be very painful, but you probably do not know. No obvious problem or no obvious injury, but just the back pain, subtle. So if that's the case, especially for those very lean older people, you may or you may not know you have cancer. Sometimes this bone metastasis is the first sign to diagnose the pathological fracture, and you went to the hospital, did the study, find out it's a metastatic tumor, and then find the origin, where does the cancer come from. So this is another important, it's not urgency unless you have neurological deficit. The pathological fracture of the spine, vertebral bone, pinch the nerve, cause your neurological deficit, like muscle weakness and sensation abnormal. If that's the case, you probably need to go to emergency. Other than that, if it is a subtle gradual process, call your physician to schedule appointment to check it out. So this is about the bone and the bone disease. Since we're on the B list, I think about the bone, just give some very superficial, very common basic knowledge about the bone and the major function and what kind of disease are related to the bone that you need to see the emergency room, and what kind of disease is a sign for you to call your physician to get the diagnosis and treat it. Alright, so that is about the bone and about this video. Thank you for watching, and I'll see you next time.